Many reasons. Nandi hospitals always been in the news, sometimes good, sometimes bad. And recently, as you've seen, that there's been a few issues which people have raised, and I think we need to be able to address. I'm grateful to the board for being so proactive, and with Mohammad Ishar coming on board as chairman, we have gained momentum in no uncertain terms. As is mentioned, that the Bulla Festival was unfortunately raising money, always talking about doing something for the hospital, but the board and the hospital put more money into the festival than what we got anything out of that. So really, at this point in time, we have nothing to do with the Bulla Festival. Apart from the board, we have had interest from Bulla Mai, that is also a charitable trust, and we will be discussing aspects of how they can enhance their support for the Nandi Hospital later this morning. Now, looking at Nandi Hospital, since I've come into office in 2009 through to now, close 5 years, I have made a special interest, taken a special interest in Nandi Hospital since 2010. In fact, if the records are put right, on the 7th of January in 2010 until December that year, I made 7 specific trips to Nandi. And over time, there has been major improvements in the infrastructure. A new hospital looks much neater, tidier, and it looks like a hospital now. At the tail end of the hospital, we've developed the fencing, the mortuary has been extended, and we will be getting you an additional lift to get the bodies up onto the 4th floor. That has always been a little bit of a difficulty, so that is on order now. Your dental department is serving its clients very well, and the maternity was run down, and through UNFPA and Fiji Health Sector Reform, there's essential equipment which have come in, and there's another set to make deliveries safer for women and safer for babies who are born. The nurses' quarters has been done up, and I'm very grateful for the support which the board has provided in this matter. The issue at this point in time is to right size the health professionals. The nursing numbers are practically just about right, and with the new nurses graduating and taking the registration exams, we should be in a position to have your nursing complement up to 100%. And we're really not way off the mark at this point in time. There are 10 doctors allocated to Nandi Hospital. However, recently there was a shortfall, and I am very grateful to Dr. Zen Ming Lo and his team of doctors and Dr. Ram Raju for providing support over the next 10 days or so, providing during the peak hours between 8 and 10 to be able to support the government system so that we are able to process the 300 odd patients who turn up to general outpatients in a day. And of course, close to 100 patients turn up to the special clinics. So we do need to be able to rationalize how we work. Sometimes it is difficult for doctors. It is difficult when you have 120 patients to see in a 7 or 8 hour shift. That equates to 4 minutes a patient. And sometimes you are under a lot of pressure. And unfortunately, sometimes people don't realize that you're working under so much of a pressure. And it can take, things can be a little heated at times, and they end up saying that the nurse was rude or the doctor was, sort of cursory in his examination. But this is the reality on the ground. So we're working around these issues, and as you know, that for the first time in Fiji's history, 75 interns joined the system. So we're looking forward in the years ahead to the bountiful years when there'll be a lot more graduates coming out, and the graduates would be then have a succession plan and a career structure so that those who want to go into public health will go into public health. Those who want to go into clinical disciplines will be able to do that. So we're looking forward to that. I was asked a question just a few minutes ago, is why can't we recruit doctors from abroad? Our payback in Fiji is not very lucrative and competing on the international market. We do not have we have not been very successful. However, there is a trickle from various other countries, and we have to make do. We have to become self-sufficient, and that's what's happening at this point in time. Now, the nursing numbers in the last 5 years has gone up from 1,500 total workforce to about 2,400 now. And that's good news because the government has been very supportive. And in fact, we have increased the intake from 90 annually to 170, and over the next 5 years, it'll be 200. So I'm hoping that 5 years down the line, we will have close to 3,400 nurses working the system. So it would be easier, it would be a lot more focused, a lot more patient-centered, and with the support of organizations like the board, we would be better placed to serve our people. As you can see, that corporate social responsibility is indeed working in Nandi. You have people from Westpac, from BSP, coming forward to do needful in provision of infrastructure development. Mr. Ishrar has talked about the role of Board of Visitors. We have given all boards of visitors a lot more ammunition to be able to provide better care to people in the process of beautifying and the health centers or health facilities, to be able to fundraise for equipment and be able to then also organize outreaches. So I see no reason why, if a certain area needs an outreach, you need to screen somebody for a group of a settlement or a village for diabetes, hypertension, NCDs, then I see no reason why the board cannot instigate that and our team cannot respond to that. So we need to work together with the private sector to be able to do that. A good example of the philanthropy by Gwendolyn Bailey is a good example of what can happen, because when she left us with a sizable amount of money, that has been put to use, purchase of equipment and helping us improve how we deliver service. So that's the other side of the coin. Whilst we have concerns about the service provided by Nandi hospital staff, and on the other hand, you have people who are very satisfied. But unfortunately, the satisfied clients seldom speak up. It's the unsatisfied clients who go to the media. And I think it's very important that the media be also take cognizance of the fact that every little complaint needs to be analyzed before you look at the problem. You've got to look at both sides of the coin before you make comments. And in this day and age where we're becoming very self-centered, we find that a lot of unnecessary issues are raised. Take this opportunity to talk about the media being able to say they keep talking about shortage of drugs. We are, let me put it on record, that we are in the process of phasing out nifedipine. Because it's not readily available, it's getting expensive. We are replacing it with a lot more modern, lot more an agent called amlodipine, and we wish to phase it out and add in something new. And that's the process. So it's not out of stock. It is being phased out. But our medical teams need to take cognizance of that, because that's been approved by the National Medicine and Therapeutics Committee. And likewise, previously we've phased out a lot of things. So everybody needs to be on the same page to be able to report these things. Now, I won't take any further more of your time. I'm happy to talk to you, talk to